All right. I am diving into fascia and learning about block therapy with Deanna Hansen today. Thanks, Deanna, coming on the show to talk about how I always love to talk about how to be fit and healthy as we age. As a lot of us are middle age and we're active and athletic, and we're just kind of the high performer doing everything probably too much. And looking at what we can do, what I call the future you blueprint, looking at, as I just said, I'm at my mom's house who's 84, and looking at how our parents aged and go, okay, I'm kind of curious of our best self.
I love talking about this. Thank you so much, Debbie, for having me on your show.
Yeah. So let's just dive into who is Deanna and what does she do and why?
Great question. So I'll start back with when this journey began for me. So I'm 56 years old now, and this all started for me when I was 30 years old. Prior to that, in my 20s, I had trained to be an athletic therapist. I'm here in Canada, so that's similar to physiotherapist, but working with elite athletes. And I was trained in how to be fit, all of those things, and my body was not succumbing to the force that I was putting into it. I was working out like a fiend, 400 sit-ups a day, Tae Bo, running, aerobics, you name it, weights in the gym. I was very strong, but I was incredibly unhealthy. The harder that I was working out, the more compressed, the more ballooned, and the more toxic that I became. So when I turned 30 years old, I made some changes in my life. And one of those changes, though, really resulted in me having some severe anxiety attacks. And it was this one attack in particular that really was the seed of me understanding the world of fascia and really creating the systems that I've put in place now. In that moment, I actually thought I was going to die because my breath was so frozen. I was locked in this fear response. For
Mm-hmm.
some reason, I intuitively dove my hand into my abdomen. And the first thing I encountered was pain, but the pain took me out of my mind, and I'm back in my body and I'm breathing, and I'm like, okay. And then I started intuitively exploring with my hands in my belly. Now, prior to that, as an athletic therapist, I always focused on deep tissue work. So I was always working in people's bodies, very good at breaking up scar tissue, focusing on people's backs and legs and necks, typically like what we're trained to do. Never had I ever gone into my own body, in my belly, let alone let anyone else touch it, because this is where I carried my 50 extra pounds of weight. And I was really ashamed of this area. I literally hated it. So I just avoided it. So now here I have my hands deep inside this space. And as I start taking my fingers through the tissue, what I observed was scar tissue riddled throughout, even though I hadn't had any injury or surgery in that area. So suddenly I had all these aha moments. Like, no wonder when I'm coming home from a run, dripping wet with sweat, my belly would still feel cold. So for the first evening, I spent 30, 45 minutes working in this area, and I felt really calm, which was not my normal. Woke up the next day a little tender, and that tenderness as I'm working on my patients actually kept me calm because now I feel more present in my body. So I was really excited to go home that night and continue the exploration. After the second time of doing a similar thing, I stood up and I felt taller. And I looked at myself in the mirror and I literally began to cry because my belly was flatter than it had looked in years, just from 2 days of doing this work. So within a couple of weeks, my chronic low back pain was improving, my neck pain was improving, my outlook on life had changed. So I started flipping my patients onto their back and I started applying to them what I was doing to myself. And word got around that I was creating these awesome results in my patients. So I started attracting other therapists that wanted to learn this technique. So that was 25 years ago. And it has evolved into an amazing journey since then. But what I recognized probably a couple of years in is that I was actually working in the fascia. Because the way that my hands were patterning through the tissue, I wasn't focused on muscles or ligaments or tendons. I was really just exploring through the tissue and allowing other people's bodies to take my hands where they were going. And that really awakened me to the fact that I was actually following the Fibonacci sequence with my hands. Somebody about 2 years in said, wow, you should really be teaching this. And I thought, holy smokes, I don't even really know what I'm doing. I'm just intuitively
Mm-hmm.
following other people's bodies. And then when I really started to pay attention to the patterning of my hands, It was, in fact, the Fibonacci sequence, which is the spiral pattern of everything in nature. So the galaxies, the Nautilus seashells, the way energy travels in nature is through waves and spirals. So it travels as a wave until there's a barricade, then it spirals, and then it ultimately becomes chaotic. So as I saw what my hands were doing on the surface, it was a very chaotic movement, but then I would find the density and I would start to spiral in until it released, and then it would open up, and then there was ease of flow with my hands. So that became a very foundational understanding for me about fascia and what happens to our bodies as we age, and really created a foundation for me to create everything I have since that time.
Wow, that's fascinating. I've never heard of that theory of just how everything is twisted, spiral. I guess is the word you said. That's interesting.
Well,
So
if you see smoke leaving a pipe as an example, right from the heat source, you'll see the smoke is leaving like a wave, and then as it gets further from the heat source, there's a spiral, and then further from that, there's chaos in motion. You can see it in water too. I lived on the 13th floor of a building right over a river, and there was a tree that had come on the other side and fallen into the river. And you could see the foam traveling in the middle of the river and getting drawn into the underside of that barricade where the tree had fallen, and it would spiral. And then you would see the foam moving in a chaotic fashion. And that is just true of everything in nature. So the thing is, when we move away from that heat source, that's what happens to energy flow. So when we have barricades in the body from scar tissue from injury or surgery, or the buildup of adhesion from incorrect alignment and unconscious breathing over time, our bodies become chaotic and the flow becomes compromised. And then that ultimately creates pain, aging, and dis-ease down the road.
there's a lot to everything you just said. That is just such a thing that I think everyone battles. And I just had flashback. My mom just was talking just a bit ago that she got something I've talked about years ago, getting kind of what I call a reverse bra to pull you back posture wise, and how all these people are getting such hunchback. But then I was just away for Christmas break and I saw it was all ages. And I started to think of it, I was thinking the word scoliosis. Scrolling, creating combined with scoliosis, that everyone in the future, I just see this kyphotic posture because of our positioning at a computer, or people just on their phone all the time. And think of those kids growing up with the phone, of how many people are going to have more problems, but how that spirals, so to speak, into all these other metabolic chaoses, how the fascia is connected to the whole body, and that it can be connected to the improper movement or flow, and connect that to root causes of different diseases. Because if we don't have the foundations in place, they keep talking about the vagus nerve, the fascia, and the lymph, how that, working upstream, how that's connected to all these health issues downstream.
Oh, I love where this conversation's going, because if I could dive in right now and talk a little bit about the fascia and the way that I see it and what my hands taught me over the 60,000 plus hours that I've had my hands in people's tissues, including my own. This you just kind of volleyed it beautifully into this right now, if you don't mind.
Yeah, go with it, or
Okay,
go with the flow.
so I really see the fascia as being the cell membrane of every cell, connecting every other cell. So it is the
Mm-hmm.
communication system in the entire body. And it's made up of a bunch of things, but the two main proteins of fascia are collagen and elastin. When these proteins are in balance, what we get is the structure of our body combined with the mobility. And if they're properly balanced, what that creates is optimal space in and around every cell. As long as there's space, there's ease of flow of nutrients into the cell, as well as the ease of removal of toxins and debris away from the cell. Space
Mm-hmm.
allows for ease of flow. Ease of flow allows for health, no matter what age we are. It's when we have barricades to flow that we start seeing issues in the body. And I mean, everything that we would see as a negative issue in the body really comes from ease of flow. So, what happens over time, because none of us are perfect, gravity is constantly driving us down toward the earth. And if we're not conscious of posture and breath, and I mean, we were never really trained to be, so how could we be? We literally wind down in one direction or the other over time. And what happens to this balance of proteins? The collagen will begin to migrate to areas of need, creating almost scaffolding so that we don't
Mhm.
tip over. Think of walking a really big dog. If it's well trained and it's walking beside you, it's not tugging on your body. But if it starts pulling you, in order for you not to fall flat on your face, the opposite side of the body has to contract so that you don't fall. So, with patterning in the body over a lifetime, it's kind of like a
Mhm.
slow moving version of that. And it's the collagen that migrates, creating adhesions, gripping onto everything in its path, including bone, with a force of up to 2,000 pounds per square inch to stop us from tipping. But these barricades, they create compression. So we become denser. We become shorter and wider. That's what happens as we age. We become shorter and wider. And now these barricades block flow. So our cells aren't getting properly fed and they're also not getting properly cleaned. So we end up with an acidic environment, which we know creates a ripe environment for disease. So the goal of, and ultimately you can call that fascia compression. We ultimately, pain, age, disease, and ultimately death are created from compression and the buildup over time. Eventually life literally gets squeezed out of us. So the work that I teach is fascia decompression, putting the space back into the body that time has taken away so that we can restore life to areas previously blocked through the three pillars of what we teach.
So just to recap, how would you define the fascia? Just to review that.
So it's literally the connector of all things in the body. Every cell is
Mhm.
interconnected through the fascia. We are a crystalline matrix. We're not just a solid body with parts. We're actually interconnected from head to toe, and everything impacts everything else. So when we're looking at the body, we can't just look at, oh, let's do something to support the heart or the liver or your ankle because everything is interconnected. So we need to look at this full body suit that we're living in. And that's the thing, because it's comprised of these two proteins, the collagen creates the opportunity to have structure so we don't just turn into a puddle. The
Mhm.
elastin creates the opportunity so we have movement so we're not just like a concrete building when those two are balanced in correct amounts. And I mean, depending on the tissue, those will change. Like bone, fascia innervates bone as well, and it's going to have more collagen than elastin, where skin is going to have a greater percentage of elastin compared to bone. But ultimately, when they're balanced properly, we have cells correctly aligned to afford us that opportunity for full space and ease of flow.
I think those are key words, have space and ease of flow. And if we don't have that proper flow in our body, how much that connects to what we've talked about over the years is, as you're saying, diseases, but even cardiovascular disease and other disease, chronic diseases related to aging. But it's always what I say, okay, why? How does that happen? Let's go deeper and then go deeper. And then you're talking, get down to the cellular level, but how the body is made. And looking at the fascia, the key ingredients of fascia are collagen and elastin. Any other key ingredients? I mean, hydration is a big part
Yeah,
of
yeah,
that.
there's a ground substance in there that also, when our fascia is healthy, then we have a glide to us. If that ground substance becomes dehydrated and frozen because of alignment, which creates flow or lack of flow, then that ground substance becomes dry and brittle and frozen. So we don't want to be dry and brittle and frozen. We want to be hydrated.
Yeah. Because that's the word flow to me. Think of a river and the spiral, but fluid flowing through the body. We have to have the tissues supple and hydrated to not have those blockages.
And that really comes from proper breathing. So the three pillars of
Mm-hmm.
fascia decompression are creating space that time has taken away, which we do. I'll get into that a little later with our actual practice and how we do that. The second pillar is inflating the space, which we do by teaching proper diaphragmatic breathing and really making the full exhale the focus. And then the third pillar is maintaining that space, understanding proper postural foundations so we don't simply fall back into those patterns that created our issues in the first place.
Yeah, so huge. One thing I've been talking about pretty much every episode for a couple of years, I think now, is the role of the fascia, but also the lymphatic system and the vagus nerve. And when we talk about the drainage pathways, starting with the foundations, getting the vagus nerve stronger, and the role of the fascia with the lymphatic system, with compressing the nervous system, and how important the vagus nerve. Have you connected all that together?
Yes. So I just want to bring everybody's attention to the diaphragm muscle, because again, this is our second pillar and this ties it all together. So for those that can't see what's going on here, I've got my hands just at the base of the rib cage. So this is where your diaphragm lives. It's a plate of muscle that when working properly and fully, when we inhale, this plate moves down in the body. When we exhale, it lifts. So with each and every conscious breath, we are getting a movement. The diaphragm is the ceiling to the abdominal organs and the floor to the heart and lungs. And the vagus nerve runs right through this thing. So when it's working properly, it's a strong foundation supporting everything up the chain. If we're not conscious breathers and we're breathing through the muscles of the upper chest, this muscle becomes weak. And then over time, what happens is we start collapsing into the core space. So this is problematic because, I mean, oftentimes people over the age of 40, they'll be like, I haven't changed diet or exercise and now I'm getting a spare tire, and they think they're accumulating fat. They're not, though. What's really happening is we are compressing and ballooning and becoming more toxic because of the lack of flow. And as we compress and balloon, that's an indicator that you're breathing from the incorrect space, the muscles of the upper chest. And here's where it gets interesting. Pain, fear, and stress cause you to reactively hold the breath. And who's not living in a stressful world today? So most of us have a breath that's compromised. When we aren't breathing diaphragmatically, we feed the body incredibly less amounts of oxygen. In fact, breathing diaphragmatically, I've read, you can feed the body up to 600% more oxygen. Every cell, first and foremost, needs oxygen to thrive. So if we don't bring the air deep enough into our lungs, we aren't reaching the majority of the oxygen receptor sites, which live more toward the base of the lungs. So if we have that stressed breath, we're breathing through the muscles of the upper chest and we have a rapid breath, we're not pulling the air to that place. So we're oxygen starved. Also, they've proven 84% of weight loss comes through proper exhalation. And for me, here's me in my 20s when I'm working out like crazy and hardly eating, but I'm 50 pounds overweight. I had no breath. I was a dancer when I was younger, and we were always told to hold in our belly. So when you're doing that, you're not breathing diaphragmatically. And so these patterns that get created at whatever moment in time, as it affects your breath, it affects your entire growth and development. And especially if they happen when you're really young, before you actually go through your developmental years, that can create all sorts of problems down the road, autoimmune diseases and everything, because the breath is everything. It is the driver of all things in the body, including the lymphatic system. Your diaphragm is like your body's furnace. I live in a building, like in an apartment building. If I have a space heater, I can only heat one room in my space. You turn on the building's furnace, you can heat the whole building. So when we're breathing again through the muscles of the upper chest, we're colder. We're not pulling that oxygen to all the cells. We're not moving the waste out of our body. So we get sluggish lymphatics. We get cells not properly fed and clean, and we start compressing. We now let gravity take the reins with how we age. Every action has an equal and opposite reaction. So gravity is this constant force pulling us down. The full exhalation is the counterforce to gravity within the body. But very few people are really tapping into proper diaphragmatic breathing. And even if right now you decide, okay, it's time that I really take some breath work exercise to heart, whatever part of your diaphragm you have available is all you're going to be able to strengthen, because when those collagen fibers migrate, creating adhesions and gripping to bone, they will hold the body out of alignment with a force of up to 2,000 pounds per square inch. I mean, think of it. It's incredible how that force is, that tension that we don't even really notice, but it's living inside our body. For somebody that's been crouched over for 30 years, they can probably stand up straight, but the second they're not choosing to do it, they recoil right back into that negative alignment. So because the rib cage also gets patterned with these adhesions, we end up locking the diaphragm, kind of like having a frozen shoulder. Most people have at least a partial frozen diaphragm. So what we teach is how to access more of your diaphragm so that you can properly heat the body, make sure all of your cells are getting properly fed and clean, which is simply not possible through that upper chest breath.
To connect that to the mitochondria.
Well, oxygen is the fuel, right?
Yeah.
Yeah. So exactly, like your cells simply don't have the energy if you don't have the breath. And we're designed to survive. So your body is going to direct whatever oxygen you do have to the organs for survival. But when it comes to thriving, your toe, a cell in your toe, your calf, your arm, they're equally important in thriving because it all comes down to balance and making sure we have proper cell alignment, which supports that space. As soon as we have a lack of space in any part of the body, the rest of the body gets pulled into that negative patterning.
Because I do Pinoe metabolism testing, which is Pinoe is a Greek word for breath.
Okay.
And part of the report that we give back to our clients is a 15-page report. Quarter of it is your breathing, because you're putting a resting test, you're putting a face mask on, we're measuring your oxygen in and your carbon dioxide out. So we can measure the ventilation, how effective you are. So we're measuring your breath. And we're also wearing a heart rate strap, so I can measure your heart rate variability and test your nervous system. So this is a great way to find out with someone, am I having some issues with breathing? I can definitely identify that testing people at rest and test the breathing while they're exercising. So the active metabolism test. Some
It
people
would
like
be
say,
fascinating for you to dive into block and do a
oh
pre-test and a
yeah,
post-test after 30 days. I would love that.
I'm just thinking that in my head, and connecting the dots again is how we're measuring breath. If people connect the mitochondria, how to burn fat is through the mitochondria getting oxygen. And when we stop burning fat, it's because we don't have oxygen. We're glycolytic pathway. So going back to your struggle with losing weight because of your lack of breath work, again, we need to always zoom out to zoom in to look at what the body does and how it needs all the moving parts to work together to create metabolic harmony, and
Yes.
how important something like this, no one's really looking at. Am I breathing? How is my posture? How am I moving through the day? And how we can do all the supplements you want, but until you work your body at that cellular level and get your breathing and your vagus nerve and your lymphatic system all working together, I just really feel like there's a lot of people wasting time and money, taking the wrong approach, not building up the foundations first, as you're talking about.
And then jumping back to the vagus nerve as well, when we're doing this work, the first class that we always teach everybody is core and rib cage so that we can again open that diaphragm that tracks the vagus nerve. And when we start moving the diaphragm and we start supporting this nerve to make sure that the adhesions along, because again, fascia innervates the nerves as well. Blood vessels, nerves, every single thing in the body, fascia innervates. So if there's adhesions along the nerve pathway because of that alignment, then that nerve isn't going to be responding properly or communicating properly gut to head and throughout the entire body. And by simply improving that full exhalation, you're turning on the parasympathetic nervous system to support rest and digest as well.
I started to pay attention to this last year when I had some clients I was working with chronic inflammatory response syndrome, SIRS is called, and mold illness, and people that had a lot of toxins in the brain basically, and how the lymphatic system was clogged. So think about this glymphatic system, the glia cells to drain while you're sleeping, and how if we don't have the pathways open through your neck, it's like a congested freeway. And how we need to work on opening up the drainage points that I love, the chasing 6 lymphatic drainage that you do the under
Harry
the
Nicholson,
clavicle.
yes, the big
Yeah,
6. Love
the
it.
big 6. And I started going into that because my friend Jody Cohen, who does vibrant essential oils, talking about how to open up those drainage pathways, but it's connecting how the fascia is wrapping everything. And if we don't have the fascia loose, and I think this is what you're saying, that you have that lack of flow, and then it's also impinging the nerve. So then we have impingement on the vagus nerve. So a lot of times people are kind of going the wrong direction, as we said, that they're not working with resolving, why am I having this congestion? Why am I having this toxic buildup? Because I'm not having the freeways open. I'm just living in constant congested traffic jam in my body.
I actually have been sharing for about 6 to 7 months now a technique where, and by the way, Jody's a good friend. I actually
Okay.
had her here in Winnipeg a year ago. We have some of her work in my membership with her
Ah,
essential oils. Combining
fun.
that with blocking is lovely. But I have a tongue decompression technique that
Hmm.
helps to broaden the jaw,
Yeah.
open up the lymphatics, and improve that blood and oxygen flow. And it takes 3 minutes. I do it every day, and I have it all over my YouTube, and I'm getting incredible comments from people that are doing this and the changes. Would you like me to
Hmm.
take you through it?
Yeah. By the way, I didn't realize you're in Winnipeg. That's funny. I'm born in Winnipeg.
Are you? Where do you live
Yes.
now?
Oh, well, San Diego, but we lived in Vancouver, Canada until we moved to Seattle,
Okay.
where I know Jody from nutritional therapy in Seattle. Then COVID hit, and then we moved, my husband and I moved to San Diego.
Oh,
So
neat.
funny, but yes,
Okay.
Winnipeg. I'm like, what? Winnipeg. So let's dive into your methods because I love to share and people watch the video to learn more. But take us through what you feel best way to start.
So, just as a note, you'd be putting your fingers in your mouth. So,
Wash
what we,
first.
yeah, so just be aware. And we hold everything for a minimum of 3 minutes because
Mhm.
our goal here is to melt adhesions to reestablish flow. So you can't rush melting. So what I'm going to do, and I'll kind of walk you through this and then I'll take you through 3 minutes of it. So I'm going to use my third and fourth finger. For those of you that can't fit both fingers in your mouth, you can start with just the middle one. And then you're going to put it on the inside below the teeth. So you're in the gum and you're feeling the bone. And then both hands are going to go in. I'll show it to you and then I'll explain.
Oh, wow.
So I'm putting my fingers down, so I'm getting to the soft part
Ooh,
under here while I'm also drawing my hands away. So I'm bringing balance, symmetry, and breadth to this area to open up this drainage pathway. So
okay.
if you want to put your fingers in, I'll time it and then I'll talk you through it. So again, we want to be like down
Down.
and drawing away. So like you're in that soft spot down in there.
You're below where the teeth are, down into the
Yes,
gooey
yes.
part.
You're not pulling on the teeth, you're pulling on the bone. So your fingers will
What
be on
if
that
you,
soft.
does it feel
Sorry?
like you're gonna gag yourself? You have that
You know,
reflex?
some people can in the beginning because, again, that's just really an indicator that we don't have a lot of space in there yet, but this will very effectively create change in space. So when your
Okay.
fingers are, sorry?
Sorry. You can go on.
So if you wanna do this
Yeah.
for the 3 minutes or no?
Well, yeah, well, I'll say my thought. I have a stuffy nose. So people that are congested all the time, if its nasal passage is blocked, I've started looking into this. If it's blocked pathways in here, would that be part of what we're opening up because it's up, your upper top of your mouth is connected to the bottom of your nose, nasal
Yeah,
cavity. So if
yeah.
people have mold issues or sinus congestion, which I swear is always mold, but congested in here, this is actually helping opening up and to help the drainage pathway by starting with this technique.
Yes, and then I'll
Okay.
share with you another one that we can share with people after we do this one.
Okay. Go ahead.
Okay, so fingers in, and I'm gonna time it for you. So as your fingers are in, what you want to do is you want to get a sense of which side, the right or left side, on the soft part under the tongue. You'll likely notice that one side has more pain, and you'll even likely notice that one side feels denser. That
Mm.
density are the adhesions that we want to stay with and melt. So you're bringing your fingers down and you're drawing them away. And then while you're doing that, if you can slowly and gently move your tongue up to the roof of the mouth, we want to create the space so that the tongue can be in that correct position. The tongue should be supporting the roof of the mouth. But for so many people, their tongue is positioned too far forward and off to one direction, and that creates an imbalance in the jaw. So when we can lift that tongue up while we're doing this, we help to nudge those deeper adhesions. So if you can breathe in and out through your nose, great.
Mm.
Obviously, if you can't, you breathe through your mouth. So you got 2 more minutes to go. You can even very gently slide your fingers a little further back, a little more forward, just so that you're getting more. And I actually do this when I'm in the bath every day, so I'm lying on my back. You can do it seated or lying on your back. For some people, they might find it easier on their back. And again, just really get a sense that you're drawing your fingers away so that we're creating space in this jaw. As we age, the head becomes longer and narrower. We should have a face that has a lot of breadth to it, like when we were younger. So what we're doing
Mhm.
is we're going backward through time in our aging process. You got just over another minute to go here. And then when I prompt you to take your fingers out, just be thoughtful because for some people, because those adhesions create that dehydration we talked about, if you pull your fingers out, they might feel a little sticky. Some people start salivating right away. Other people, it feels kind of dry until you really melt those adhesions and get that proper flow going. So when it's time, don't rip your fingers out. You want to take them out
Mhm.
thoughtfully so you don't overdo. So let's just take 3 more slow breaths here. And you can take them out when you're ready.
I'm
All
starting
good.
to drool on myself.
Yeah, yeah. And obviously for people that have like long fingernails, that likely won't
Mm.
work for you. But how
Mm.
did you feel? Like, how do you feel now? Do you feel like your jaw's in a
Ooh,
bit of a different place?
yeah. It feels that
You
my
actually look
jaw,
different already in your jaw.
I feel it feels different for sure. That it's like, well, yeah, that it was open and just feels more, I guess, released or worked on down and below.
And the alignment of your jaw, everything is a mirror. So we have all these foundations in your body. I've had some people say, wow, from doing that, I felt my pelvis shift. So everything is interconnected. So the
Mhm.
way that you chew, the way that you see the world, everything is patterned in through the whole body, but just changing the jaw itself will
Mhm.
change other parts as well. So another thing that you can do for this area through here, because again, pressure over time, that's the key. You can just take your third and fourth finger, you can rest your head and you can just apply direct pressure into this space. And so again, similar to the action, you want to push down and then you want to slowly, we're not going to move the fingers on the tissue, but just move in that direction so you feel like you're opening up the space in through here. If you sat and you did that for another 3 minutes, now you're going to be melting a lot of the adhesions that are blocking the flow in the sinuses. And while you're doing that, I do just want to share we have a paddle. It's called the block paddle, and it comes with our facelifter program. So
Oh.
we use this paddle to work all the areas in the face to get all the areas opened up and released. And the paddle's really lovely because the face is such an interesting, intricate structure with the bones and all the different grips and like cheekbones and all the areas. So this gets in so beautifully. And actually, at the end of this month, I'm doing a 21-day facelifter challenge, which will include 6 live classes. And we're even going to be getting inside the nose to really open up these spaces and into the eyes as well. Because imagine if you have, say, a fall or an impact, like you hit something really hard, your head jars, and then the eyes get locked. And if
Mm.
they don't get released, then we're seeing the world through the lenses of eyes that aren't properly aligned. And that also patterns us into negative alignment. So we have something for every part of the body and for everything to bring that balance back in.
Well, it sounds that if people middle age that were as myself, for example, working on, yes, I can breathe right if my nose is congested. We can't really do great nasal breathing if my nose is always stuffed or dripping, feels congested in here, but also the under eye area if we're concerned about wrinkles. Doesn't that help open up and create more flow? Does that help with our eye area and our facial lines?
Absolutely. Because again, like that's really what it comes down to. We want all the cells to be proper aligned. When we're looking at the fascia on the face, so what happens is because the adhesions, they don't just move linearly, they follow that spiral pattern in nature. So let's say like I'm sitting like this all the time and my head is always tilted to the right.
Yeah.
Gravity is impacting me differently than if my head is always tilting to the left in what it's getting pulled. So if I have a jowl on my right side or I have a hood over my eye, that's because of this alignment. And then
Mhm.
what happens is the collagen will grip to bone to prevent me from tipping. But now that imbalance of that collagen elastin, now I've got the jowl, that over elasticized tissue that starts being impacted by gravity and it starts to hang. So with this work, what we do, and I mean, we can use the block or the paddle, but by staying in position for 3 minutes as we work, and we're not sliding on the surface, we're staying locked in and then moving as the melting occurs and it becomes more fluid, we're releasing those adhesions, those collagen proteins to bring back that balance so that the elastin and collagen can regain their structure with the mobility that we want for youth in our bodies.
So is that similar to foam roller? I know that there's a gal that created the melt method years ago for
No,
fascia.
it's
So
not.
it's
And here's
block
the big
therapy.
difference. Yeah, anything that you're rolling, you're getting those surface areas, like surface layers addressed to stimulate circulation there. But those collagen fibers or proteins, those adhesions will grip to bone. And that is where the root of the issue is. And so think of taking a boat on the ocean compared to deep sea diving. We want to go deep sea diving through our layers of fascia so that we can get to the root, release it from the source, and integrate proper flow and alignment going forward. So there's a lot of differences. Yeah.
So you're speaking of melting it open, going deeper, but it's using a block. Is that what
Yes.
block therapy is about?
Yeah, so I've got two tools here, the Block Buddy, the Block Baby, different sizes. Most people love having both, but I always say if you're over 5 feet, you want the Buddy, under 5 feet, the Baby, but you really do want both if you can, because there's so many uses throughout your body with the different tools. And then we do have the Block Paddle that started out as basically our tool more for the face, but it also has application through the entire body. And the reason that we use wood, and they're made here from Winnipeg elm trees, so it's these are trees already being cut down because Dutch elm disease has spread rampant through Winnipeg. So they're already cutting these trees down, but the problem is in the bark, not the wood. So we're
Oh,
using these trees that are cut down and repurposing them for
oh,
healing.
nice.
But the reason that wood is important is because wood and bone are similar in density. So
Mm.
as we are driving through those layers, if we use something porous, that won't be able to penetrate to those deeper layers of adhesion. And that's why we have wood, and they're all very specifically shaped so that as we do dive deep through the layers, there's a comfort to them. They're beautifully rounded, and we can use all the different angles and sides and all of that to figure out how to maneuver properly in our body for both comfort and effectiveness.
So this is something we can add into our routine each day. How often do you do this?
Yeah, most people that begin this journey, it becomes a daily practice because the benefits are so far and wide from feeling calm inside your body because right away it does tap into that parasympathetic nervous system. And by the way, it was Jody Cohen's book where I learned that we should be in parasympathetic 80% of our day.
I
And most
know.
people are in sympathetic the majority. Even when you're
Yeah.
sleeping, I've read that some people are still in sympathetic. So
Yeah.
to really change that is really important. I forgot what I was going to say now. I
Uh,
got veered
well,
away with
just how
Jody.
often to do it to
Oh,
feel
right.
better, right? To test.
Yeah. I always say to people, if you can do it as a daily habit, even 15 minutes
Yeah.
every day will do far more than like say once a week for an hour and a half. It's those daily habits because this really does create the habit of proper breathing. And really the foundation of this work is accessing the diaphragm. It really does come back down to the breath as being the most important thing we want to do, but we need to learn how to access the diaphragm, and the limbs are really what's manipulating the core of the body. I do a lot of work with people with scoliosis, and when you're looking at the x-ray, you're just looking at the spine, but what's creating that? It's the limbs pulling the body out of alignment. We have one foot that draws away from the body like a flat tire, and then in order to not fall, the other foot anchors, but this creates twisting up the chain, and then the arms become patterned as well. So we release the arms and the legs to really bring balance and symmetry back into the core. So when we're just dealing with the area that we think is the issue, oftentimes we're never getting to the root of the problem and we're just managing as opposed to
Mm.
really transforming.
Hmm. Okay, so how do you know? Okay, wait, before I go there, that's how do you know you have problems with the fascia? Some
Everybody does
okay, just
because
assume everyone does.
everybody does. I mean, anybody that has any issue with anything, your fascia is part of the equation simply because fascia innervates every single cell. So whether again we're talking bone, muscle, nerve, blood vessel, organ, It's all
Mhm.
innervated by fascia. And the goal of the fascia, one of them is to make sure that our cells are correctly aligned. And if that's the case, then there's the space for flow. And that's what our body needs is ease of flow. When there's a lack of flow, there's stagnancy, there's acidic environments created. Now disease starts taking over, and so on and so on.
So ease of flow, flow of with
All
the
of it,
lymphatic
nerve flow,
system,
lymphatic
bile.
flow, blood flow, everything. We want flow. Like we don't want anything to be stagnant. I mean, it
Yeah.
was interesting. I was working last week with a young boy. This was my fifth time going to Prince George. He had a very serious car accident 2 years ago, and I've gone out there 5 times now to work with him, making incredible changes. But they've got 4 cats, and I have some allergy to cats, and now I'm staying in their home. So I came home and I'm draining, and I'm still
Mhm.
going through this draining process for 3 days. And I think to myself, man, somebody taking some kind of a sinus thing to stop the drain, I have probably pulled out multiple cups of stuff from my body over the last 3 days. And to think that if I didn't have this happening and I stopped it, it would still be stuck inside me. Like that's horrible to think. Like I felt like, like when you can't blow your nose properly, I felt like,
Mhm.
I've got constipation of my head. It's a horrible thought. I used to be
Yeah.
constipated, so I know how you feel when you don't have flow in your
Flow.
body. But
Hmm.
either way, all flow matters. We just want to be fluid, but structured correctly so that where there is flow, I mean, it's optimal. So we can properly feed and properly clean. When you're at your best and you're fed and you're clean, you've got the energy to do whatever you want to do. When you're dirty, exhausted, and starving, you're not going to be the best version of yourself.
Hmm. So how would you correlate any functional lab testing to know that fascia is an area of opportunity that there's congestion? Have you worked with practitioners to look at, do we see the lipid panel higher or bile higher or other like liver detox pathways open,
I think
elevated?
one of the best visuals is thermography because
Mm,
that's where you can really see
yeah,
where the inflammation is and where there's that lack of flow. And we have a number of thermography or people that have done that have shown those
yeah.
differences. I mean, I have probably a couple 100,000 people in the world that are blocking now in a private Facebook community that has over 20,000 members, and they share their changes, those medical markers. They're often getting shared through my community. But I would say that no matter what it is, if you have something negative and you start doing this work, you're going to see those changes. And if you get those follow-up tests, I've had one of my first instructors, she was a woman age 69, and after 3 months of blocking, she shared that her bone density increased on her test. So it's anything and everything because again, if we have liver that has um, blocked fats in there, liver or butter at room temperature is a fat, heated up, it's a liquid. So people with fatty liver disease that start doing this work, you're putting heat into these areas where there's stagnancy, and then you start to create that healing opportunity in those spaces. People have come off their heart meds. People
Yeah.
have had thyroid things change. I mean, anything and everything.
That's what I'm thinking in my head, going, okay, if you could open everything up and have, as Jody always talks about, the traffic on the freeway congested, that having that flow, good, no traffic jams in your body, how that could help so many different areas, and looking at how we're just more toxic. And speaking of this time of year, we're recording this beginning of a new year that people are doing detox programs, and how I think it will backfire for most people starting in the wrong order of operations, trying to do some type of cleanse or detox because their drainage pathways are not open, which we say is
Yeah.
phase 3. But how that drainage pathways to be open is working on the lymph and the fascia and getting that
And I
flow
loved how you,
first.
yeah, I loved how you mentioned the head too. A couple of years back, I took a number of my members who had post-concussion syndrome, and I started adding in daily eye decompressions, and I wanted to take a few of them through it. So again, like similar, like when we have an impact in the head, now you have debris, just like the traffic jam or the traffic accident on the road. You got to first move that away before you can bring in the paramedics, because if something's in the way, you can't get to that space. So when it comes to the head, if we don't have that rib cage open, the rib cage is the foundation of the head and the neck. the arms and the hands, they're manipulating what's going on in the rib cage. You're not going to have those opportunities for optimal drainage to create the space to then allow the blood and oxygen and other healing nutrients to get in and create that actual repair. So we always have to look at a distance from where the issue is, because upstream or downstream, there's something blocking and everything is interconnected. So it becomes really a full body journey whenever you dive into this. But that is the most exciting thing, especially if people are afraid to work in an area because of the trauma. You can start at the feet to impact your head, and then you can start working towards those areas of concern if that's an issue for you.
Yeah, that's what I started to mention earlier, but how so many people had mold or other areas, but they could just had so many chronic diseases. And I started to look at their history, their timeline, and looking at their posture. And one for client, for example, was seeing a physical therapist to work on their neck and shoulders and their thoracic spine. Then I started going, there's all this connection here, the fascia and the vagus nerve. Are you impinging those nerves in your neck so you don't have that drainage? Then you have all these brain inflammation issues. And so is it something we're not addressing? That's why I would love to go into the root cause. That are we working at a foundational level before we start adding in all these supplement protocols or people on all these medications that really are not solving why is this happening? Is it simple as this to get things open first?
Very, very much so. If you even took your right arm and you took it the other hand with it and put your shoulder into internal rotation and imagine holding this for a month,
Yeah.
that shoulder is going to be tired. And just look at what's going on in my neck here. Now, if I go and I get this work done, it might feel good for a moment, but if you release the hand and you allow the shoulder to go back and down, then you're taking all that tension and stress away. You're opening up the channels to the neck. So again, like the feet, the hands being the next furthest from the engine, these are so impactful in the alignment and everything that's going on up the chain and through here. So I've got a couple of little things I can share with people. They can start right away with their feet and their hands that also make a tremendous difference. That combined with that tongue decompression, that's a game changer for people if that's all they do.
Yeah, before you do that, I just thought of two. I see patterns just, again, I was on a cruise during Christmas, so I really was good people watching of all ages and looking at how many teenagers look horrible, their posture, and they're all, on their phones. And then even, the 20-year-olds, then we go up to, of course, 80, 90-year-olds are looking poorly. But so it's, as we said, young adults to older adults. And I think how this is so important to start this now, because it's just going to get worse if we don't do something, and how connected it all is.
More than
So,
ever. And I remember probably 15 years ago, and I've heard this from other people from different perspectives saying the same thing, that this will be the first time in human history where the youth will die before the older population because of how they grew up. I mean, the toxicity is one whole thing, but the alignment with the phones and like that's really created the perfect storm for them to be twisted and unhealthy. I don't know if you ever saw the movie It. It was a horror movie, Stephen King from the 80s. And then in 2016, they had a remake. So it was really interesting because I saw them both. And it was very strange because in the 2016 version, they still had the hairstyles and the fashion of the 80s, but these kids were twisted. And it was just so interesting to see how far along they've degraded in their alignment since then. And it's everything because again, if you're twisted, you're congested. You do not have that flow. And they're growing up with a breath that has been compromised from the get-go because their mothers now, they likely were on technology as they were in the womb developing. And with those mothers having compression greater than our mothers, now there's less space in the belly for them to form and grow. And there's twisting that happens. And in yoga, they say that we're born with a signature posture, and the goal of this lifetime is to break through that signature posture. I see that as we are born in this lifetime with our mother's breath, and the goal is to change our breathing pattern. So the mother of today, her breathing pattern is very different from the mother from the 60s and 70s and further back because the world is so different. So these kids are coming out highly compromised from the get-go.
Mm.
We used to see babies breathing diaphragmatically, and then over time we lose that as pain, fear, and stress add up, and reactively we hold the breath. I'm now seeing babies coming out not breathing at all through the belly. They're already upper chest breathers. And I mean, it's just sad because now they're mitochondria, they're not getting those patterns formed properly. And yeah, so this is needed earlier now more than ever.
Well, and to the toxicity in our environment, but just how we're not getting rid of those toxins if we don't have that freeway open.
Yeah,
So we're more congested, but that means to me we have more toxins sitting in our body and stored in the fat cells and having more problems. So
exactly.
for sure. So let's go kind of finish up with the program and the example, but just go over the three parts of your program: is space, inflate, space, and
Creating space,
yeah.
inflating space, and maintaining space. So we become shorter and wider over time. We lose space. There's a time-space continuum. As we go through time, we decrease in internal space. So this work puts the space back into the body, taking the time out. So from the perspective of youthful aging, that's what we want. We want to take the time that's accumulated out, which is really just the compression and all that comes with that, so that we can reestablish proper flow and space around each and every cell.
Mm. And I think this is important too for those athletes that are biking. Bike posture is horrible. That same as the desk posture, and then they try running, and then how that impacts their breath because they can't be running up tall and opening that up. So I think for athletic performance, this will benefit those aging athletes as well as just people that are just trying to maintain posture.
Absolutely. And I
Mm.
do see that athletes are some of the harder ones to work with because they are so strongly patterned with intention to perform a function that down the road creates a very strong, dense, twisted body that's harder than just the person that's unconsciously falling out of alignment.
Well, and two triathletes, as I did Ironmans, that were swimming forward freestyle, right? And then we're bike riding after that. And then you're running probably poorly. And so just if you've done that for years, how
Yep.
really messed up your posture on top of a daily work activity posture and your phone and just life. So let me know what exercises you want to go through and what if you could tie in any what I call habit stacking. Would it be beneficial to, using the block, using nitric oxide lozenge or something, and the essential oils, or what would you do to optimize if people are really busy and don't have, they think, enough time to do any of this? Add in anything you think.
Okay. I mean, I'm like, block therapy is a beautiful complement with anything other people are drawn to. And that is anything and everything. Again, I love Jody Cohen's essential oils. Whether you're combining it with Pilates or yoga or other exercises or other supplements or acupuncture, whatever it is, you want the open space for the flow of nutrients to get to the site designed, as well as if it's other bodywork practices, you want your cells to be open and spacious to receive the benefits, because wherever there's density, there's not energy that's going to get through that. So in combination to any other practice, this is a really good foundation. So what I would share is between the webbing of the fingers and the toes, I've got a number of YouTube channels just showing people, but ultimately we want to repattern the toes first and foremost because the toes are the furthest from the engine. So how you walk really cements your patterning in. If you've got a frozen shoulder and you get that worked on and then you start walking, you're right away getting pulled back into the alignment that created that in the first place. So to repattern your feet is huge. So 3 minutes between each toe. And I know this sounds like a long time, but it doesn't have to be all done at once. And you can do it while you're sitting watching a TV show. But taking a finger, a pencil, or even a cord and just putting it between the webbing of each toe for 3 minutes if you can, less if you don't have the time. But you'll feel the changes in how much more of your toes become activated in your gait, in your standing for your balance. They've connected longevity and toe strength now. So for those people getting older and listening, when we have weak toes, we fall more. And that's going to create problems. So we want really strong toes that are part of how we move and how we balance in life. Also releasing the patterning of the fingers, because again, that internal rotation that gets created and how it impacts everything up the chain to release the hands, huge. So I would just move the thumb and the index finger, spread them apart, and then push the webbing of both hands toward each other, 3 minutes, then between the third and the fourth and the fifth. So 3 minutes between each while you're focusing on the exhale. If you just try this once, I'm pretty certain you'll be like, this is worth it. If you don't feel it's worth it, fair. But when we create more space between the digits, feet and hands, it's a game changer. And if it becomes a regular practice, everything changes.
Another random thought that came in my head. My neighbor, for example, I'm sure there's a lot of people retiring and they switch to doing something else full time, pickleball,
Yeah.
or what he's doing paddle, and how he keeps coming to me. I've got this injury. I've heard it so many times. People stop working full time. They start filling their days up with playing paddle, pickleball, but any paddle sport, and how this would be beneficial for people that are going from desk jockeys to now full-time paddle jockeys.
It really would, because especially when we're doing anything that's really one side dominant, we're creating that patterning very quickly to pull us out of alignment. So I would say that, if like fun aside, because again, if you love the sport, you want to do things that you love, but you also really want to look at the buildup of what's happening. This work, which is a symmetrical body work, yoga, which is a symmetrical body work, Pilates, all of those things where you're working both parts of your body in a balanced way and you're lengthening and strengthening, as opposed to activities where you're twisting and you're turning, always focused on one side, or you're in the gym doing weights, which creates compression, density to create strength. Those things add up negatively over time. So the more you can do things that open and create space, the better long term for aging in a really healthy way.
uh, when you're doing this, and does it mean anything if one area is more congested than the other? Is that correlated, especially feet are connected to different parts of your bodies, or connection?
Everything is connected. So
Yeah.
yeah,
So
absolutely.
if
And I
you're
mean, you
like,
can even tie in the reflexology points
yeah,
to the hands, the feet, the ears. I mean, all of it is interconnected. Like what organ, like where you have pain, it's a signal. It's letting you know there's something going on somewhere else. If we were
yes.
perfectly aligned, every step we take would be like a reflexology treatment. But because the feet aren't aligned properly, we're getting too much pressure in certain areas, no pressure in other areas. So we're not communicating properly throughout the body because we're not aligned anymore.
I was just talking about foot reflexology the other day and how the map of your foot to the spine and the organs would be interesting to wear those. I used to have the sock that had the map of your body on the
Okay.
body of reflexology points. I don't have them anymore. But the other thought too is that I'm just reading finally Born to Walk by Mark Sisson and my friend Brad Kearns, and how wearing the 5 toe type of shoes and how to retrain, stretch your feet out, and how shoes and wearing, of course, pointed shoes and high heel shoes, how they really impact your feet, and how this is kind of working on releasing those in between the foot metatarsals to stretch that open and have the fascia. But correlating that too to people that think as I age, I need to wear shoes because my feet hurt more. I had someone say, I don't know if shoes are, it's not that you need to wear shoes because your feet hurt when you're walking too long barefoot, and it's not good to walk barefoot. I've been told. It's like, wait, what? That makes
I
zero
don't agree
sense.
with that.
I know.
No,
Well, that
but I
was,
mean, I understand that for some people because they have pain, but the pain is because of the negative alignment. So there's so many things that like I actually did a video a couple of years ago that went viral called Death Starts in the Feet. And I have so many foot classes in my membership, like probably 18 different foot classes in my membership alone, because the significance and importance of getting all of the 26 bones in each foot in correct alignment, because this determines everything up the chain.
yeah, it makes sense how it's all connected, but just how many times our feet are so locked up and pain, and the hands from computer work or the mouse and typing on your phone and your computer, that I always find that. And then I lift weights a lot, so I'm tensing up, and then if you're driving your car and if you're riding your bike, is that the forearm to elbow and everything gets so tight and congested there that can go all the way up into your neck and just nonstop. So that's great.
Absolutely.
Amazing. So where can we send people to learn more and talk about what you offer?
My website is blocktherapy.com. And I also have a private Facebook community group that is open to everyone called Block Therapy Community. There's over 20,000 members in there. And I love that as a resource because if you ask questions, you're going to have people sharing that will have had experiences like you, whether it's different diseases or different issues or chronic pains. So you'll get people in real time sharing their experience with you, which just brings such a deep wealth of wisdom to the community. And they're just so lovely. I'm so blessed with the community that we have.
That's good. And how long have you been having this program set up? When did you start it?
I started this 25 years ago, but block therapy came
For the,
into existence probably around 2012. So,
it's been a while.
since 2020, it's really, started to take off on a different level. I also have a free gift if it's appropriate to share with everyone.
Sure, go ahead.
It's a 9-part series of classes where I teach you using a rolled up towel. So you can start right away. And I mean, you're going to get a ton of benefit from it alone, and you will feel what fascia decompression is all about. You will be able to access a deeper breath. We also do some postural foundation work in there. So we can give that to everybody right away, and you can dive in. And if this speaks to you and you want to go further along, then we have everything as a resource there.
Well, amazing. I'll put all the links in the show notes and people can click on it and learn more and just start experimenting, see how you feel. Cause I'm manually adjusting my arm and my hands now. It's just, you can feel how just right away it starts to feel better as the word flow keeps coming to my head, that we're just opening up. Flow is a good thing. Not
Yes, it is. It's
open
everything,
everything
really.
up. Yeah, it is. Flow of life. Maybe that's the word of the year. If you still haven't figured out your word of the year, I was doing resiliency is my word, but may have to switch to flow, resiliency
Hello.
and flow.
Love it.
All right. Well, thanks so much for sharing your knowledge and following your purpose and your passion and your mission. I think that's so important to keep at it, and being consistent with it, and just see the impact you've made over the last few years is amazing. Being at it for 20 something years, but seeing this growth, that it's like, all right, finally people are listening, right? That's like, oh,
Yeah,
I've got it. People figured out, but sometimes it takes people 20 years to figure out, oh, this, this is really something. So
for
good for
sure. Well, thank you
you.
so much, Debbie. It's been a pleasure to be here.